And coming up next, Business Report producer David Weir talks with healthcare pro Scott Greenberg, who runs an elder home care business called ComForcare's Senior Services. Dave asked Scott what his operation was all about.
So we are, Dave, we're a private duty non-medical home care agency. Simply, we put caregivers in people's homes or in communities like assisted living communities if people need additional help.
Well, what exactly do you do for the people?
So Dave, we help people with typically what is called activities of daily living. So we'll help them bathe, we'll prepare meals, we'll transport them to the doctor, to the beauty parlor, to the shopping. We'll do some light housekeeping, we'll do some laundry. Bathing, if I didn't say that, is really important. So we try to help people improve their quality of life. Most people think that when they get help, it's the beginning of the end of their independence. Right. Frankly, Dave, it's the opposite. When you get a little help, it actually improves the quality of your life. It restores your independence, and that's what we do. We hire caregivers and put them in people's homes.
Well, do you deal mostly with the parents of people up north? Is that what's happening? Is that a primary market for you?
Yeah, more and more that's true, Dave, particularly in Florida, because this is the retirement capital of the world. People have moved down here, and they moved down in their 60s when they've retired, and now they're in their 80s, and their kids are still up north. So very often we are dealing with remote families and kind of being the eyes and ears of what's happening for their parents and keeping them safe and secure and healthy.
Well, do you keep in close contact with the people up north on the status of their loved ones down here?
We do, on a regular basis. We're in communication with children from all over the country. In fact, from all over the world. Today, everybody's all over. So we have clients whose kids are in Singapore and in London, and we talk to them regularly whenever there is a reason to update them or just to keep on a regular schedule of keeping people informed.
Well, Scott, you know, are you seeing an increase in dementia and Alzheimer's among your customer base?
You know, Dave, that's a critical question. The incidence of Alzheimer's and dementia is an oncoming tsunami. It's growing exponentially. There are over 5 million people with Alzheimer's disease in the United States today, and nearly 10% of them live in South Florida. If you live to be 85, 1 in 2 people who are 85 are going to experience some level of dementia, according to statistics.
And we all are living longer.
We are all living longer, but not necessarily healthier. So our families, our grandparents didn't struggle with Alzheimer's and dementia because they didn't live that long, but today they are, and so it is probably, probably the chronic disease that requires the most focus. And yes, we're seeing a tremendous growth in that area.
It's also debilitating. Do you get involved with the explosion of dementia and Alzheimer's? Do you get involved in another very brutal situation with caregivers, do you?
Well, we do, and what we try to do in the area of Alzheimer's and dementia particularly, over and above what the state requires, and the state does require some training in Alzheimer's and dementia care, we in our office conduct a program where we bring caregivers in to explain to them about behavior modification techniques, redirecting behavior. We talk about avoiding triggers, and then we talk about activities, particularly activities that can keep people who are struggling with Alzheimer's and dementia engaged. So we do some music activities, we do some memory games, we do some aroma games, everything to bring people, to keep them active and not just sitting in front of the television or not doing anything all day. So we bring our caregivers in twice a month. We've done 45 in the last 5 weeks, had caregivers come in specifically to train on a program that we call Connecting the Dots. So it's identifying triggers, teaching behavior modification to move somebody away from whatever it is that's a struggle at that moment, and then to give them something else to do through behavior modification and activities.
Through your people, they go out to homes and look after the people in the homes or in assisted living facilities. You don't have a physical building or
no, we don't. We are actually the person who's standing by most of our clients. So most of it is in the home, and we typically can go from anywhere from 4 24 hours a day, a couple of days a week, to 24 hours, 7 days a week. But we also sometimes people need additional help in the community that they live, independent living or assisted living communities, and we'll go there. We'll even go to a hospital sometimes and sit overnight if a family is worried that there isn't enough focus.
How do you get paid for all this?
Well, most people pay us. It's private pay. Medicare does not pay for our services, but long-term care insurance, people who have long-term care insurance tend to access health sooner, but it's private pay. There are some veterans benefits out there. The aid and attendance program is a terrific benefit most people don't know about. And then occasionally there are some Medicaid programs that will cover long-term care. But for the most part, the services that we provide are paid for either by long-term care insurance or private pay.
I got you. Listen, Scott Greenberg, we're running out of time. Would you? Thank you so much for being here. You got to come back. We got to talk about some other stuff involved with the elderly population in South Florida.
I would love to do that, Dave. I can't thank you enough for having me. Thank you much.
All right, Scotty.